Some of Manitoba's commitments for healthcare are getting mixed reactions after Tuesday's speech from the throne. Among the promises, creating a patient safety charter, legislating the number of patients assigned to staff in priority areas, and putting an end to mandatory overtime for healthcare workers.
I can hardly wait for it to happen. However, I don't believe we are at a position with staffing at this point that we're going to be able to do that successfully.
Manitoba Nurses Union President Darlene Jackson argues the province still needs more nurses if it wants to stop mandatory overtime.
I believe that, first of all, patient care is going to suffer.
University of Manitoba Associate Professor of Nursing Sonia Udod agrees.
Who will take care of the patients when there are, no nurses to take over? So I'm not sure how that's going to happen.
As of last month, the NDP government says nearly 3,400 net new healthcare workers had been hired across the province in its 2 years in power. Of those, 1,100 are nurses. On Wednesday, Premier Wab Kinew once again blamed healthcare management for the ongoing practice of mandatory overtime. He insisted the system does have enough nurses.
The issue is the hospital administration. We've been giving them all the money. We've been giving them all the staffing resources. We've been giving them the direction. It's time for them to show results.
CBC has reached out to all 5 regional health authorities and Shared Health for comment. The opposition questions how the government will enforce their promises on OT.
I think it's pretty wild for the Premier to say that we have enough nurses. I think it's pretty clear that we don't. Anyone who's visited a Manitoba hospital lately will tell you that.
The Nurses Union says if only some areas of healthcare have rules around staffing per patient, other areas could suffer. The health changes are expected to come forward in the spring legislative session. Rosanna Hempel, CBC News, Winnipeg.